You know that tingling in your feet? That little pins and needles feeling you might brush off? Well, it could be your body sending you a really critical warning signal. It's often the first sign of diabetic neuropathy, a complication that a lot of people with diabetes are living with. But here's the scary part. By the time you really start to notice it, the damage might have been quietly happening for years. So let's dive into what this all means, because what you learn in the next few minutes could genuinely protect your health for years to come.
I want you to just let this number sink in for a second. 50%. That's 1 out of every 2 people with diabetes who will develop some form of neuropathy. It is by far the most common complication. And like I said, what's so concerning is that it's sneaky. The damage can be progressing silently long before you feel that first tingle. So what are we really talking about here? At its core, diabetic neuropathy is nerve damage. The best way to think about it is like a garden hose. If you put a kink in that hose, the water gets blocked, right? And all the plants downstream start to wither and die. Well, in your body, chronically high blood sugar acts like that kink. It damages the tiny, delicate blood vessels that are the lifeline for your nerves, cutting off their supply of oxygen and nutrients. And when that happens, the nerves start to malfunction and, eventually, they can die off. But here is the hopeful part, and it's a big one. Your body does send out warning signs. The absolute key is learning to recognize them early, before the damage becomes permanent. So let's get really familiar with what those signals actually look and feel like. You know, neuropathy isn't just one single thing. It can show up in different ways all over the body. There are 4 main types. The first, and by far the most common, is peripheral, which affects your feet and hands. Then there's autonomic neuropathy, which messes with the internal organs you don't consciously control. Think your stomach, your heart, your bladder. Proximal can cause weakness in your thighs and hips, and focal can hit a single specific nerve. Now, while you can have more than one type, we're really going to focus on peripheral, because that's the one most people experience first. Okay, this is so important. These are the symptoms you absolutely have to catch early. This is the stage where you can make a huge difference. We're talking about that classic pins and needles tingling, or a numbness that might feel like you're wearing a thin sock when you're actually barefoot. Maybe it's a burning feeling, especially at night when you're trying to sleep, or even an extreme sensitivity where the light touch of your bed sheets is actually painful. These are not feelings to just ignore and hope they go away. And here you can see how it typically progresses. The symptoms usually start in the parts of your body that are farthest from your heart and your spinal cord, so your toes and your fingers. From there, it slowly works its way up your feet and hands, almost like you're pulling on a pair of stockings and then a pair of gloves. This stocking-glove pattern is a textbook sign of peripheral neuropathy. This is the million-dollar question, isn't it? Because ignoring these little signals, these subtle changes, can start a domino effect of really serious problems. It can build from just a simple tingle into something way, way more severe. And this is exactly where that sense of urgency comes in. The journey from a little bit of tingling to permanent damage is a path we want to stop dead in its tracks. Taking action early isn't just a good idea, it's absolutely essential for protecting your health and your mobility for the long haul. And believe me, the stakes could not be higher. Once nerve damage becomes severe, it's often permanent. You can't turn back the clock. When you lose feeling in your feet, a tiny cut or a blister from your shoe can go completely unnoticed. That little wound can turn into a serious, deep infection called an ulcer. And tragically, foot ulcers are the #1 cause of diabetes-related amputations. Beyond your feet, autonomic neuropathy can disrupt your digestion and heart function, and it can even cause something incredibly dangerous called hypoglycemia unawareness, where your body stops giving you the warning signs of a low blood sugar. Okay, I know that was the heavy part, but now let's talk about the empowering part. Because you are not powerless against this, not at all. There is a clear, proven playbook for protecting your nerves, and it's much more within your control than you probably think. If you remember one thing from this entire explainer, please let it be this. The single most important thing you can do is maintain tight glucose control. It's not just one piece of the puzzle, it is the absolute cornerstone. Everything else we're about to talk about supports this one central goal. And we have the data to prove it. This isn't just a guess. Major studies, like the famous DCT trial, have shown that intensive glucose control can slash the risk of developing neuropathy by a massive 60%. To put it another way, other research shows that for every single percentage point you lower your A1C, you can reduce your risk by about 35%. This chart right here just shows you how incredibly powerful that one intervention is. So, tight glucose control is your #1 weapon. What does that mean in practice? It means aiming for an HbA1c, that's your 3-month average blood sugar, below 7%, and at time in range, the amount of time your glucose stays in your target zone above 70%. You back that up by managing your blood pressure and cholesterol, quitting smoking, which is terrible for blood vessels, and limiting alcohol, which is directly toxic to nerves. And of course, making daily foot care an unbreakable habit.
And look, making daily foot care a habit is so simple. It takes 30 seconds a day? Every single day, just check your feet. Use a mirror for the bottoms if you need to. Wash and dry them really well, especially between the toes. Put on some lotion, but skip the area between your toes to prevent infections. And please, please, never go barefoot, not even in your own house. This simple checklist is one of the most powerful things you can do to stop a small problem from becoming a life-changing one. But what if you're already having symptoms? What then? Well, the goal shifts to management. It's about slowing down the progression and treating the symptoms so you can maintain your quality of life. The message is still one of hope, and it's still one of control. Treatment is really a two-pronged attack. On one side, you have to manage the symptoms, especially the pain with things like prescription medications or physical therapy. But on the other, more important side, you have to relentlessly attack the root cause. And what is the root cause? You guessed it. It all comes back to optimizing your glucose control.
This is exactly why your partnership with your doctor is so critical. Getting an annual foot exam where they use this simple little tool called a monofilament to test for sensation is one of the best ways to catch this stuff early. And it's on you to report any new or changing symptoms to your healthcare team right away. Don't wait for your next appointment.
And this is where technology can be a total game changer. Modern tools let you do so much more than just see your glucose numbers. You can start to connect the dots between those patterns and your symptoms, your food, your activity. For instance, a tool like My Health Gheware can help you and your doctor spot these trends over the long term, giving you way better insights into what's actually impacting your nerve health.
So when it all comes down to it, it's about this. The health of your nerves, your future mobility, your quality of life, it's all profoundly influenced by the small choices you make every single day. So after hearing all this, I want you to ask yourself, what is the one change, just one, that you can commit to making starting today? And finally, just a very important reminder. This content is for educational purposes and is not a substitute for professional medical advice. Always talk to your doctor for diagnosis and treatment. And seriously, if you have a cut or a wound on your foot that isn't healing, please seek medical care immediately. Don't wait. Thanks so much for tuning in.